Assalamualaikum warahmatullahi wabarakatuh. Hi guys. First of all, let me introduce myself. My name is Rachma Dewinda. You can call me Rachma. I am part of the Applied Bachelor of Medical Laboratory Technology. At here, I want to explain about my poster that I have made before about HIV disease. HIV, human immunodeficiency virus, is a virus that attacks the body's immune system. If HIV is not treated, it can lead to AIDS, acquired immunodeficiency syndrome. There is currently no effective cure. Once people get HIV, they have it for life. But with proper medical care, HIV can be controlled. People with HIV who get effective HIV treatment can live long, healthy lives, and protect their partners. HIV infection in humans came from a type of chimpanzees in Central Africa. Studies show that HIV may have jumped from chimpanzees to humans as far back as the late 18th century. The chimpanzee version of the virus is called simian immunodeficiency virus. It was probably passed to humans when humans hunt these chimpanzees for meat and came in contact with their infected blood. Over decades, HIV slowly spread across Africa and later into other parts of the world. The virus has existed in the United States since at least the mid to late 1970 centuries. In Indonesia, the spread and transmission of HIV is mostly caused through unsafe sex and taking turns using unsterilized needles when using drugs. A person infected with HIV can transmit it to others. Even from a few weeks after contracting it, everyone is at risk of becoming infected with HIV. HIV has several stages of the symptom. There are 3 stages that will be experienced by the patients. Stage 1. Acute HIV infections. The first stage of HIV is the acute infection stage, which occurs in the first few months after a person is infected with HIV. At this stage, the infected person's immune system forms antibodies to fight the HIV virus. Symptoms at this stage appear 2 until 4 weeks after infection occurs. Patients generally do not realize they have been infected with HIV because the symptoms that appear are similar to flu symptoms and can disappear and recur. At this stage, the amount of virus in the bloodstream is high enough to make it easier for transmission of infection to occur. Symptoms of the acute state of infection can be mild to severe and can last from a few days to several weeks. Symptoms include fever to chills, arrest appears on the skin, vomit, pain in joints and muscles, swollen lymph nodes, headache, stomach, ache, sore throat, and thrush. Stage 2. Chronic HIV infection. Latent period. After a few months, HIV infection enters a latent stage. The latent stage of infection can last for years or decades. At this stage, the HIV virus remains active, destroying the immune system, but multiplying in smaller numbers. Symptoms of HIV infection in the latent stage vary. Some sufferers do not even feel any symptom at this stage. However, some others experience the following symptoms: weight loss, sweating at night, cold diarrhea, nausea, and vomiting, herpes zoster, swollen lymph nodes, headache, fatigue. Stage 3. AIDS. Latent infection in treat too late will make HIV more developed. This condition makes HIV infection enter the third stage, namely AIDS. At this stage, the body's immune system has been severely damaged, so the patients will be more susceptible to other infections. Symptoms of AIDS include losing weight without knowing why, sweating at night, white patches on the tongue, mouth, genitals, and anus, purple spots on the skin that won't go away, fever that lasts more than 10 days, chronic diarrhea, infection in the mouth, throat, or vagina, swollen lymph nodes in the armpit, neck, and groin, nervous disorders such as difficulty contracting, memory loss, and confusion easy bruising or bleeding, body feels tired, easily angry and depressed, rash or spot on the skin, hard to breathe. HIV has the most severe in the third stage, which can cause the patient resistant to be vulnerable, making it easy to get sick, and will progress to AIDS. Patients must immediately take ARVs. Once diagnosed with HIV so that the development of the HIV virus can be controlled. It is important to remember that delaying treatment can allow the virus to continue to damage the immune system and increase the risk of infection leading to AIDS. That's all of my video. Thank you for watching and have a great day. See you again. Wassalamualaikum warahmatullahi wabarakatuh.